Let's start off with the common causes of falls, things like trip hazards, balance issues, and even medication side effects. Here's what you need to know about how to decrease your risk of falling.
Falls in older adults are not normal. We know that falls have known risk factors, and what you can do to help yourself prevent falls is talk with your primary care provider and identify what your unique risk factors are. Then you can work with your provider to reduce those risk factors. And you can work with an occupational therapist to help them identify home modifications that could be made to make you safer in your home.
In the state of Washington, about 27% of elderly people will experience at least one fall, and about 20% of those will result in death. So avoiding falls is a good way to live longer and not have severe injuries.
There was an article that was created by the American Geriatric Society, the British Geriatric Society, and the American Academy for Orthopedic Physicians called The Guideline for Prevention of Falls in Older Adults. And this article identified the most common risk factors for falling. So the number one risk factor for falling is muscle weakness. The second most common risk factor is a history of falls. Number 3 and 4 are gait and balance deficits, and number 11 is an age greater than 80 years. So it's very interesting because age all by itself is not a good predictor of falling. But the top 4 among them are muscle weakness, gait and balance deficits. Those are all modifiable risk factors. You can work on those risk factors and improve them and reduce your risk for falling.
One of the common culprits are medications that are used to treat anxiety, depression, and high blood pressure because what they can do is make us dizzy and disorient us, and we lose balance, which is crucial. If you're trying to not fall, you need to have good balance. And so these medications will treat those primary conditions, but the side effects can definitely be the reason why we fall. It's important to tell our doctor because they might be able to help us avoid a fall in the future. And one interesting statistic is that once somebody falls the first time, they have a much higher chance of falling in the future versus someone who has never fallen. So if we discuss this with our doctors, they can do things like reviewing our medication. Maybe our high blood pressure pill is too strong. Maybe they can drop it down a notch. They can also assist us in referral to programs that will strengthen us. They can give us advice. They can ask questions about our home situation and whether or not it could lead to a fall. So having a health professional be aware of a problem early on is good. And there should be no shame or embarrassment in it. It's something that happens to a lot of people.